talking about it as a benefit, but I didn't know whether that was going to be. Good afternoon. Can you hear me?
I can hear you, Tracy.
Good stuff. Thank you, Peter. Does everyone want to introduce themselves in the chat just while we're waiting for people to arrive? Give you something to do. Keep you out of trouble for a bit. I'll just give it a couple more minutes. Just while we're waiting, if anybody's got an AI magical being recording this or transcribing it, please can you switch it off? Because it is all being recorded. it will all be transcribed, so you've no need to take notes or anything. Well, you can if you want, but you no need to take notes or anything. And I call it an AI magical being because I have no idea how it all works. It's all fairy dust and magic to me. Okay, we're bang on 2 o'clock now. So we'll start. If anybody else arrives, I'll let them in as we're going along. Just making sure everybody's here for the right reasons. You're here for People of Pendle. You're not here to learn about cookery or cake making or icing or anything, because I am useful at that. Useless at that. Leanna, you wrong place. Do you want to learn about cake baking?
I think I know enough about cake baking, but how to build a wardrobe or shelf or something like that would be good.
Or maybe next time, maybe
Yeah,
next meeting, that's what we can do. We can have some hints and tips on how to build a
Yeah.
wardrobe. Fabulous. Thank
Baking, I'm
you.
all right.
Thank you, everyone. Oh, there's still people arriving. I love People of Pendle. There's loads of us that come. Just to tell you a secret, Burnley Linked isn't as well attended. Shh, don't tell anyone. Apart from Geordie. Geordie turns up all the time, don't you, Geordie? Okay, so we'll start. So welcome everybody. Thank you all for joining me on this. Well, I'm going to say rainy and wild afternoon, but it's started sun shining now. I don't know what it's like where you are, but this weather's just been, it's the wind that scares me because it is very destructive, is wind. Rain, I don't mind. I can wander about in rain, despite my hair. My hair just goes like flat to my head and then grows out like Diana Ross when it starts drying. So welcome everybody. Thank you very much for joining us this afternoon. And there's still more arriving. Great stuff. And I did send out on the agenda that we had no guest speakers this time, with nobody in the spotlight. And then 4 of you got in touch to say, I'll speak, I want to talk. So, so I'm gonna let you all talk. That'd be great. So I'll go in the order that you got in contact with me. So Peter, you got in contact first. So thank you for that. So if the floor is yours.
Okay. Will I be able to share? Oh, get a bit of echo there. Can you hear me all right?
Yeah, that's fine. Yeah, you should be able to share, Peter.
Okay. So I've done this once before, but there's usually often different people at People of Pendle meetings. So very briefly, this is some mapping work that I've been involved mapping what faith venues, so churches and mosques, are providing
No
into
updates.
family support, food security, and mental health support. So yeah, we did this, reported this first 2 years ago. So I'm conscious I'm sitting on quite a comprehensive data set. So for those 3 areas, we've done there's 3 questionnaires, and respondents complete these, usually face to face or over the phone. That then populates an Excel spreadsheet, and the spreadsheet contains all of the information about the things that are happening in a church or a mosque, what day, who the contact people are. You then RAG rate, red, amber, green, and then that creates an interactive Google My Maps. So let's see if I can share one of those. Not that. It's the one I want. Share content. Oh yeah, there we go. Well, hopefully you can see there's a map of the Pendle boundary, and all the places of worship are marked red, amber or green. The teardrops are churches, the diamonds are mosques, and also on here we've got in blue the 2 family hub centres. So if I click on one of these symbols, it takes you to sort of a legend panel on the left, which has the details of the contact details. There's a mosque in Cole. So I think this shows the locations of places, and particularly thinking of family hubs, it might help staff to see where their nearest places of worship are, but that will apply to anybody. Yeah, so just this information might be helpful to people, and I'm quite happy to share this with anybody who wants to, for whom it might be useful. So just, get in touch with me, and I can send you the raw data, and also the links to these maps. And we are creating a website for Lancashire, which will be like a one-stop shop for this information. But in the meantime, if you want to contact me directly, I'll send you this data. Okay, that's really all there, Tracy. I'll try and stop sharing.
Thank you, Peter. You've stopped sharing. It's gone off our screens.
Okay.
Leanne, I think, might have a question for you.
Yeah, Peter, I just wondered, it's been such a long time since I've seen an updated version of the spreadsheet, and I don't know whether there has been any updates. So I wondered if I drop you an email directly, is there any chance I could get a copy of the most up-to-date version? Would that be okay?
I don't think there's any, there's no, I mean, that's one of the next steps, Leanne. If I'm able to get funding, sort of an enabler person, one of the things they might do would be to look into updating or even completing any of those places we didn't manage to first time round. But I'm certainly happy to send you what I've got.
Okay.
Yeah.
And I can just compare it with what I've already got. It might be that I don't, what I have is what you have already. It's just so that I'm not missing any gaps. That's all when I'm reaching out into Pendle. Thank you.
Yeah, Peter, if you want to send it to me or Lorna, we can put it on the People of Pendle webpage if it's not on there already. And then people can access it from there.
Right, good idea. Yeah.
Fabulous. Anybody else got any questions for Peter? Nope. Okay, fab. Thank you, Peter. Thank you for stepping in first, being first in the queue. Val, you were my next one. You were number 2. So Val, do you want to tell us about Boost? You're on mute.
Can you hear me now?
Yeah.
Afternoon, everybody. So yes, it's the first time I speak in the People of Pendle, so I'm a little nervous. Anyhow, so quickly introducing Boost to Wellbeing to you all. So Steve and I, we deliver classes in Pendle already to assist people with mental health and well-being. So we work a lot with the CVS, with social prescribers, with various charities, and the classes that we deliver are mainly yoga. So very gentle yoga, which is chair-based or on the mats. And people can register directly with us or through the social prescribers. So we deliver in Hodge House in Nelson on a Wednesday. We deliver in Corn and Briarfield on a Thursday. And then on a Friday, it's a Civic Hall in Barnoldswick. And we also have a boxing class, which is delivered in Corn on a Wednesday at Singer's Gym at 2:15 p.m. So if anybody has any interest or knows anybody that could benefit from the classes we deliver, please get in touch. We'd be happy to talk. So quick summary for you.
Fabulous. Thank you, Val. You did very well. No need to be nervous. We're all friends here.
Thank you.
Thank you very much, Val. Has anybody got any questions for Val? Just while I'm thinking on as well, you will have all received an up-to-date membership list of everybody that's a member of People of Pendle. So everybody that's on here, all their details will be on that membership list. But you can put your email in the chat as well. It's entirely up to you. But if you forget, don't worry, everybody's got your contact details. Thank you, Val. Thank you very much for being number 2.
Thank you.
Matt Donnelly, you were next on my list. You number 3.
Hello. I'm Matt. I set up something called Pipe Play across Lancashire. So I work with Together an Active Future. So I'm Ribble Valley based originally, but my work's gone across the whole of Lancashire recently. So Pipe Play is it's a bit like Park Run. So it's a charity. It's nationwide charity, and its aim is to set up group play sessions, generally on a Saturday or a Sunday, every day of the year, every week of the year, not day of the year. I keep saying that. Every week of the year, and it's community driven. So basically how it works is that if a community organisation or a set of people is interested in setting up a pipe play for their community, they can get in touch with us. We can work out how we kind of get the funding to set it up, and then we, as Pipe Play, come and help and train up the local volunteers and set that up with them. So currently we have 1 in Burnley, 3 in the Ribble Valley, and 1 in Blackburn. And we've just been in discussions with a few people from the Pendle area in how we could possibly set one up in there. So basically, I wanted to introduce myself and just put it out there to people in the Pendle area and to spread the word and see if this is something that could happen in the Pendle area.
Fabulous. Thank you, Matt. Has anybody got any questions or anything for Matt, or want to indeed to say, yes, I want to do this, has got a burning desire to do this? Not at the moment, Matt, but don't take that as nobody's interested.
No,
it's a
that's
slow
perfectly
burn.
Acceptable.
Generally,
Yes.
it's a slow burn, and people will be in touch, I'm sure. Also, Matt, just while I'm thinking, our volunteer hub has a new system called, what is it called, Caroline? Remind me. Is it Get Volunteering? Yeah.
Yeah, that's right. Get volunteering at BPRCVS.co.uk. I'll put it in the
Okay.
chat, shall I?
Yeah, that'd be brilliant. And that's where any organisation that wants volunteers can register an opportunity on there, and volunteers can directly see all the opportunities. So they would come through, we manage it, so they would come through us and they'd have done their statutory training with us. But then it'd be over to you. Caroline will stop me if I'm wrong. Then it'd be over to you to kind of train them up on your project and things like that. So it might be quite useful for you, Matt, to put the opportunity on there.
Yeah, very useful. Thank you.
Yeah, brill. Thank you. Yeah, Matt's details should be on the list, but I'm sure Matt will put his email address in the chat if we ask him nicely. Thank you. Okay, brill. Thank you very much. We're whizzing through this today. So the next on the list is Leanne. Leanne, you were last but definitely not least to say, can I have a few minutes? So fire away.
Oh, thank you, Tracy. Yeah, good afternoon, everybody. For anybody that hasn't met me, my name's Leanne. I work for Pendleborough Council and I'm the Community Engagement Officer. So my role within the council is to deliver on all of the council priorities, but I work directly with all of our community-based groups. So in particular, so like the voluntary sector, the faith sector, and the anything that's based in the community. And part of the work that we've been doing over the last sort of 9 months, there's been a common thread of one of the highest needs of the community is food. Obviously, like, I think that's something that we know about and we've been shouting about for a long time, but underpinning that is that we're seeing that people need food support because there's a lot of debt. We've got a lot of debt within Pendle, and it links back to council tax, and I think that's a national problem, but it definitely is a Pendle problem as well. But underpinning that, it's not just a council tax problem, it's a digital problem. So people can only get council tax support by using an online digital portal. And there's a lot of people that are based in our community that just are not online and that struggle with digital barriers for various reasons, you know, that are known and unbeknown by many of us. So we've sought at Pendle Council, we have a customer and digital strategy that we're working towards, that we are aiming that by 2028, we are going to be providing with all residents of Pendle with the ability and the resources to access online services. So working with our community groups and organisations that we work with at the moment, how we are starting that is we are doing a 12-month rollout of drop-ins where we are doing a drop-in for each of the 5 boroughs in Pendle. So the main 5 boroughs that we're looking at is Colne, Nelson, Briarfield, Barnoldswick and Earby. So at the moment, they're the 5 core places that we're looking at. Potentially, if we choose to extend that, we may then do Trawden and we may do Barrowford, depending on how popular the other drop-ins are. So the idea is that there are going to be around 1 every 10 weeks, and they're going to be situated within a community organisation that we know our community access. So it might be somewhere that operates a food bank or that has a parent and toddler group. So, for example, our first drop-in is going to be held in Colne, and it's going to be held at the Open Door Centre, and it's going to be for an extended sort of time scale of 2 p.m. till 6 p.m. I'm sharing this information with you now without a presentation or without promotional materials because they are in the process of being created. So when we have the next People of Pendle meeting, I'll have some official materials to be able to share with you all, because we are heavily going to be promoting these on social media. We're going to be at jobs fairs. We have involvement and partners involved from DWP, from Christians Against Poverty, Citizens Advice, Lancashire Adult Learning, and myself from Pendle Borough Council. We have support from Pendle New Neighbours at the drop-ins that they feel is appropriate for them. We have support from other digital partners like AbilityNet that work with the older age range. And the idea is that we are going to have those organisations at each event that is going to be a drop-in. So we are inviting residents to come along to the event with their own digital device and access some one-to-one face-to-face support, whether it be that they just need to know how to access their NHS app online, whether it be that they know how to set up an email address, or it could be something even more complex, like they have a council tax debt, or they need to open a council tax account, or they don't know how to apply for a new wheelie bin. So it could be a range of different needs, and we're aiming that anybody that attends, they'll be able to access support for whatever their need is on that day. And then so some of you may have received a request for some information about digital services that you provide as an organisation. So at the moment, I'm also doing my own mapping, which we are going to be creating into a digital directory, which will pretty much be like a booklet, like an old school Yellow Pages style booklet, so that when somebody has attended the event and they've accessed some one-to-one support, they will leave with a digital directory in a booklet form, and on that will be information about any online, free, face-to-face digital course that a resident can access outside independently in their own time, so that we are providing them with the resources to continue with their own digital journey, whatever that might look like. So we've also joined with the Good Things Foundation to be part of the National Data Bank. So the aim is that those people that attend that might need support with accessing the internet because they don't have a SIM card, or they might, and that's something that we might be able to issue with them on the day. So it's going to be, each event is going to be coordinated by Pendleborough Council, but it's going to be delivered by partners. So although I might be there leading the event and making sure that everything runs smoothly, the partners really are the really important people that are going to be delivering the face-to-face support, like Christians Against Poverty, Citizens Advice, DWP, Lancashire Adult Learning. And as people come in, they'll be accessing support from the service that's suitable for them on the day. So that will be rolling out. The first session is going to be on the 14th of May. Originally, it was going to be on the 7th of May, and then I realised that that was a polling day, so we put it back a week. And all of the first promotional materials will be started to be rolled out at the jobs fair that DWP are hosting on the 30th of April in Colne. So I'm going to have a stand there that will be signposting people to the first drop-in, because what we've found is through some research that when people are moving in, whether they move from another area to Pendle, or whether they've been made redundant, or whether they're a young person moving into their own property for the first time, when they sign on to Universal Credit, they're not provided with the information that they have to set up their own council tax account, and then they have to evidence that they're on Universal Credit to be able to get a reduction on that, and also they can receive single person discount, and DWP just don't have the time to advise people about this. So as a result of that, we have a lot of council tax debt. So this is our response to the debt, but then as a roll-on sustainable provision, we are looking at commissioning some how-to videos that people will be able to watch for years to come on how to set up a council tax account, how to apply for council tax reduction, and we're going to have those professionally made, and they will be displayed in places like your community centres, your food banks, job centres across Pendle. So that's just a little bit of a brief overview of what's to come, and then hopefully at the next People of Pendle meeting, I'll be able to provide a clearer picture, because we'll have some materials published for people to be able to see what's happening, exactly what dates that they are happening on, and what's available, where people can find more information if they need it.
Thank you, Leanne. I think Jodie has a question. I have as well. I like Jodie ask hers first.
Mine wasn't so much a question. I just wanted to make sure that you're aware of us, because that's literally what we do on a daily basis, every single day. Every single day we're supporting people to do council tax bills, universal credit, log-ons, migrations. We support people to do anything digital. So that I've just realised my headphones up, isn't it? Sorry.
No,
So
I can
did you
hear
hear
you.
that?
Yeah.
I'm not loud, you see. I don't need a mic.
I could hear that, Jodie, but I don't know what organisation.
So I work for Advocacy Focus, and we've got a community focus hub directly in the centre of Burnley, but we cover across all of East Lancashire. So we do go and visit people in Pendle, across Pendle, directly in the homes, out in the community, and we do this directly with them and for them, directly out in the community. So I don't know if it's worth me dropping you an email and having a bit more of a longer chat with you about us, because it's literally what we're doing.
Yeah, please do. Please email me, and well, what I'd like to do is probably meet up with you if possible.
Yeah.
Is your service free to residents of Pendle?
Yeah.
Right. I knew of Advocacy Focus. I absolutely knew that you existed. However, I didn't know that you were free for. I thought you were similar to ICANN, and I know ICANN are free for Burnley, but they're not free for Pendle. So let's have a let's email and catch up and
Yeah.
bring you in on this, because I really do think that the amount of partners that are on board, this could be really beneficial, and the more we have on board, the better, the more impact we're going to have. Yeah, brilliant.
Defo.
Thank
All
you
right.
for that, Jodie.
No worries. Thank you.
Thanks, Jodie. Thank you, Leanne. Anybody else got any questions before I ask mine? No. No, you stunned them all into silence there, Leanne. What I was going to say was, what about people who just do not want to? It's not about skills. They just don't want a digital footprint. What kind of provision is there for them?
In terms of,
in terms of council tax, DWP, etc., etc.
What we found is that those people that don't want a digital footprint, they can ring Pendle Council and book an appointment with somebody and attend number one if it's for reasons such as maybe they're fleeing, domestic abuse and they don't want a digital footprint. It could be for various reasons. There is ways around that, and they can book face-to-face appointments. I don't know if what that looks like in terms of what that support, how that support is provided, because we outsource that to Liberata.
Yeah.
So I don't know. Is my honest answer. I can try and find out for when I do deliver something officially next week, because that's going to be, that possibly could be a question.
Yeah.
What we have to do is make sure that those that don't have any reasons for not having a digital footprint, is that we are moving in a world that you are going to have no choice but to have your council tax and benefits and things like that. They are going to be online unless you've requested not to be. So we need to make sure we have a duty to provide that for our residents in whatever means that be, especially with the new Crisis and Resilience Fund, is that households are being moved. Well, we are providing support to help households to become more resilient rather than to be in a crisis point. So we have to respond to crisis, but then now provide support to help people to be resilient. So I can find out some information of how they would go about that, because I'm sure that that's not just a Pendle question.
Not.
It's going to be a UK question.
Yeah, it is.
That there's going to be families in poverty that are going to have council tax arrears, but they do not want to have a digital footprint. There is a lot of the older generation who don't want to learn this stuff.
Yeah.
But what we're finding is that they have been residents of Pendle for a long time. Their council tax and things like that will already be set up by direct debit. So there isn't a need, but we need to make sure for those that do want the support that we're putting provisions in place.
I just thought I'd mention it, Leanne, because sometimes they've forgotten of those people.
Yeah,
because we are in such a digital age, and it's not just those fleeing domestic. It's just that they just don't want a digital footprint. They just don't want it. There's no reason for it, but they've got their own reasons for it.
Yeah.
And I think we are all being pushed into that digital stuff. I just think they get forgotten sometimes, and you're quite right, they're usually the older end, but there are some younger people as well that are now coming round and going, actually, I don't want everything, I don't want all that. So yeah, it'd be worth finding out, and it'd be worth asking, because I am sure you're going to get asked this question.
And it's interesting, Tracy, because I attended a conference last week, and it was a national conference delivered by Resolve Poverty, and it, through some research that was done by an organisation there, it became out that there is a lot of people that just don't want a digital footprint. So although we are in a world where we are moving quickly into a digital world, we're also getting a lot of pushback that people don't want that. So we're going to be flipping the switch, and where people were moved online because of COVID, now we're going to be looking back into putting in more face-to-face work. And I think that's something that we're going to see over the next few years,
I agree.
that organisations are going to start having to bring people back into the office rather than being remote, because that's just what people are asking for.
I agree wholeheartedly. Thank you, Leanne. Thank you very much. Anybody else got any comments or questions for Leanne before I move on? Sorry, my voice keeps going. No. Okay. Thank you, Leanne. Thank you for that. And thank you for those of you that asked questions, and Val and Peter that also and Matt that also jumped in at the last minute and gave us a few minutes on their organisations. Brilliant. Thank you. So just moving on, emerging themes is the next thing on the agenda. I put this on the agenda each time, and I'll just give you a little bit of background. This is about feeding up, because these meetings, People of Pendle meetings, they're not only for all you wonderful people to make connections and gain resources and ask questions and find out about other organisations. They're also about finding out what's going on in the community. So the likes of me and Leanne and Jill, when she can attend, can feed up into the Health and Wellbeing Partnership that creates the action plan that Pendle work to, or all Pendle Council work to, the PCNs work to, NHS works to across Pendle. So this is about any emerging themes. We've had some before. I've just taken some from Leanne. You know, food support is needed because of the debt, so it all feeds into each other. And then that digital literacy stuff. Is there anything that your beneficiaries or your clients or whatever, your patients or whatever you call them, are coming in and you're seeing regularly? Is there anything, Katie, you're usually good for this. Is there anything that your clients are coming in regularly with?
Yeah, I was going to say, one of the trends that we had for quite a long time was women coming out of domestic abuse relationships and struggling with debts that had been built up during that time. We're finding now it's more and more, it's people who are single. If you're single and out of work and claiming basic universal credit with no add-ons like limited capability for work or PIT or anything else, then you are basically financially not able to live. Especially if you have a spare room in your house, then there's bedroom tax that's added onto that. If you're in private rented rather than in housing association, then there's often a top up of your rent. So if you're getting £400 a month, you're having to top up your rent by say £50-60, that leaves you with £340. Gas and electricity, even if you try and cut that back as much as possible, you still have council tax to pay, even if you get the council tax support. You need a phone so you can make phone calls, or it's just all this, and you just find you're in a situation where you cannot afford to live. So we're finding more and more people, and I think that's probably the same with Jodie. I mean, I saw Jodie this week with somebody who's for the last 3 years has worked for 30 odd years as a nurse, is 65 and has been in really ill health for the last 3 years, has had no support, and has been living off £390 a month.
Wow.
And she's selling everything. She has no money, but her health is really poor, and she's on limited capability for work, but it doesn't really pay for it. It just means she doesn't have to go to the job centre, which means she's not having contact with anybody. And it's just in a situation now where she has no money. So we went to Jodie's office last week, and one of her colleagues is round there today helping her get a PIP form filled out. But yeah, if you're single and out of work, it's really, really difficult. And we have clients that go to work then for a little bit and then come out of it, like due to health reasons, and then that just throws your universal credit all over the place. So yeah, families, I know families struggle, but single people, it's really hard. Yeah.
Fab. Thank you, Katie. Has anybody else got anything else or anything to add to what Katie said? Jodie?
I second what Katie said, but as an organisation, what we're coming across from the Pendle area specifically is a lot of people who are struggling with prescription services. So this is more of a question as well as letting you know what's happening. In Burnley, there's quite a good network of people who, if they aren't able to get and collect their prescription for a whole variety of reasons, there's different pharmacies and different pharmacists that have that ability to drop off. I think maybe because it's a little bit more rural, there's just not the same services. So there's a lot of people not having regular medication. And from our perspective, it's a bit of both. Like I say, it's me kind of bringing this forward to your attention, but then also asking, is there anything that you're aware of that, I don't know, a communicast kind of a thing? I don't know, because we've looked everywhere and it's not, we can't seem to find anything or any kind of service that does that kind of prescription transport.
Okay.
Yeah.
Lynn, can you help?
I was just going to ask, Jodie, is that in the Nelson Briarfield area or is that in Burnley?
So far, no, Burnley we're fine with. We know the networks in Burnley for people to be able to have that support. So far, it's been Barley and where was I want to say Briarfield, but it might not have been Briarfield. But there's been a couple in those areas. We've also had Bake Up that's come up, and there was another place as well, but it's gone.
If
Menopause.
it's within, it made me laugh at that one, Jodie.
Sorry.
If it is in the Nelson Briarfield area, I'll pop my email in the link. I can help you. So I'm part of the PCN and I work with all the surgeries. So I have an idea which surgeries do the delivery service.
Great.
So
Yeah.
I'm more than happy to help on that if you come across anybody. But we don't work in the east over Cone and Barnoldswick, so I don't know about them, but I will certainly put my email in. More than happy to help.
That'd be great.
Yeah.
Thank you.
Yeah.
Thank you
Yeah.
so much. Yeah.
Kelly James just said something in the chat as well, Jodie. Kelly, do you want to unmute yourself and
Sorry to jump on, Lynn. The majority of the pharmacies in the area will do a drop-off service. It's part of their contractual obligations.
I'm talking about them without, I kind of don't want to speak upon the clients too much, but they're the kind of clients who can't necessarily get to the door or receive the prescription, sorry. Does that make it? I'm trying to not speak upon them too much, but the more complicated cases, shall we just say, Yeah,
Lynn, do you want to come back in?
Yeah, me and Kelly work together, so I agree with what Kelly's saying, but we can liaise with you and the pharmacist, so we'll take case by case. So just give us a shout, Jodie, if you've got anybody that you're struggling with. Thank you
so much for that.
I'm sure, Jodie, if we put you in touch with somebody at Pendle East, Pam's on here, who's one of the social prescribers. I'm sure that Pam will help out or point you in the right direction. Go on, Pam.
Yeah, of course we will. It's not a problem. Just let us know. I'll put my email address in the chat, and then if you need anything, just send me an email. We'll work together and sort it out, I'm sure.
Thank you. Thank you ever so much.
We're like the A-team. I love it when I plan things together. See, you just have to ask on People of Pendle, and people, they know. So thank you for that. Thank you, everyone. If there's anything that comes up, please do whiz me an email. We want to feed it into the Health and Wellbeing Partnership, and also it gets fed into the Lancashire Partnership as well. So it's not just Pendle, it will get fed up into the Lancashire-wide partnership. And Christine, our chief exec, she works at that strategic level all the time, and it helps people, it helps those decision makers to make decisions. If we can influence and make decisions and help them to make decisions, the right decisions, rather than somebody in an office somewhere miles away making a decision about what needs to happen in Pendle, that's great. So please do whiz me an email if you think, oh, I should have said this straight after the meeting, a bit like I do. I think, oh, I should have said that. Lynn.
Yeah, sorry, Jodie made me remember something as well. We've actually got a couple of menopause sessions left for tomorrow, 11:30 till 12:30. So if anybody wants to message me, it is for the Nelson and Briarfield patients. Please let me know. We've got some sessions. You might want to put yourself on, Jodie.
I'm going to say, me and Jodie will be there, but we
Right,
both live
come
in
on.
Burnley, so.
Oh, hey, you can join us anyway. It doesn't matter. But if you've got anybody that you're working with and they're struggling with menopause, give me a shout. We've got some spaces left for tomorrow.
Fabulous. Thanks, Lynn. Thank you for that. So I'm gonna move on swiftly, because time flies, doesn't it, when we're having fun. So this is just a really quick one from Pendle Network for Change that is connected to People of Pendle. If you remember, we did that lovely health gathering where we all sang the Hokey Cokey, amongst other things. And see, that brings it to people's mind, and they all smile. So yeah, we did. Anybody that wasn't there, we did do more than just sing the Hokey Cokey, honestly. But we created a toolkit from that. And one of the things that we are working on, or just looking at the moment, is something called Why Wait, spelt WEIGHT, to talk. And this is about obesity in Pendle. And it is a project being funded by Lancashire County Council, and with Pendle Council leading on a healthy weight declaration. And Pendle statistics for adults living with overweight or obesity is 68% of the population. There's some training going out, and I want to invite anybody that's interested to a meeting on the 14th of April. I can send you more information if you want it. And this is about getting that information about weight and healthy eating and all that kind of stuff out there to the community, rather than it being clinicians that are saying, look, I mean, I've been there, I've been sat in a doctor's surgery and they said, you need to lose weight. And I've gone, okay, walked out of there, completely forgotten about it, gone and eaten a cake. I haven't. But it needs to be, my argument is, because this says, you know, I've got the write up in front of me saying that colleagues from a wide range of backgrounds can benefit, and they talk about social prescribers, which is great, but they also talk about GPs. That's not going to happen. So my argument is we need community groups to start giving this message out, because as we know, again, at the risk of sounding like League of Gentlemen, local people trust local people. So if you're already delivering like Val's wellbeing sessions and yoga sessions, then you can then start having that conversation around healthy weight. So if you would like to come along and talk to the organisers with me, I am more than capable of going, hang on a minute, you're doing it wrong. Let's do this differently. You know, for me, it's about the language that's used, the way that it's done. You know, just a waggy finger saying you need to lose weight ain't going to make people lose weight. It's not. So if you would like to come along, please do give me a shout, whiz me an email and say I'd be interested in that, or please can you give me a few more details, and I would gladly give you more details. So thank you for that. Thank you for indulging me and Pendle Network for Change. So information sharing. So has anybody, I know I'm going to go around my screen. Just if you've got nothing, or you know, it's absolutely fine. Those of you that's already spoken, I will not come to you again, so don't worry, you don't have to talk again. So if I can remember who you were, no, I've got it. Yeah, I've got you written down. I can't remember who you were. So I'm just going to go around my screen, just a couple of minutes, just, you know, this is new or not. Those of you that need to go, that's absolutely fine. Don't worry about it. We'll see you next time. So Jodie, you're first on my screen. Have you got anything you want to share?
Only to share that the charity is getting together with, oh God, Lancashire Women. God, I'm having a bad day, aren't I?
That's why I've got everything written down, Jordan.
I should know. It's literally on the window there as well as an advert. God. Anyway, we're getting together with Lancashire Women on the 30th of April to do a charity event which is called Dazzle and Decadence. We're getting some people together to put on some posh frocks, wear some nice jewellery. People get to bid on them, and then obviously all for a good cause. I think you get some free shampoos as well. I'll send out the poster though afterwards. All right.
Fabulous. Thank you, Jodie. Thank you. Kelly Jane, have you got anything you want to update on? You can just go, no. Fab, thank you very much. Fahana, have you got anything you want to tell us? Is she there? She might be just pretending to be there. No, she's disappeared. I'll come back to her. Okay, Caroline, do you want to update on anything?
Yeah, I just want to say we've had our second coffee, cake and collaboration event on Wednesday just last gone. And we're hoping to put the next one on in Pendle somewhere. So what it is basically I don't want to say networking. That sounds too.
Yeah.
I don't know.
It's coffee and
together.
cake and a chat. You get cake and a chat. Yeah.
And it's for small organisations or larger organisations who want to meet other organisations in the local area. So, as I say, next time we're going to be in Pendle. We talked about volunteer management last time, so perhaps a similar theme, but that's just a little guidance. You don't have to talk about that. You can talk about anything you want with anybody who's there. Okay, so I was just putting the call out. If anybody's got a room available or thinks, oh, that would be a great place to put it on, just let me know. That'd be great. Thank you.
Yeah,
okay, sorry, I was just trying to figure out how to unmute myself, so I was pressing the wrong thing.
Anna, I'll come to you in just a second. Give me a sec.
Okay.
So the coffee, cake and collaboration are really free flowing. It's for anybody that volunteers or is involved in a volunteer-led organisation or volunteer involving organisation even, to come along, talk about various issues. It's led by the people that are there. So we give a little bit of guidance, but it's not set in stone. And like Caroline said, we're after somewhere in Pendle. So if anybody's got anywhere, I'm looking at you, Dawn Mulgrew, that you might have a little room for us.
Yeah, Caroline, drop me a message. I'll put my email address in the chat. But yeah, drop me a message and I'll have a look for you. So we do have some decent sized rooms. It depends how many people you need it for really, and whether we've got capacity, because we are filling up rapidly at the moment.
That's good news.
Which is a nice problem to have.
It is. That's excellent. Thank you, Dawn. Thank you very
Okay.
much. Thank you, Caroline. Fahana, now you've figured out how to unmute yourself.
I know it was right up there. I just wasn't looking at it. That's all. Chatting Chimers delivers creativity sessions. As you know, I think I've met many of the people on this at other meetings. Our theme is creative mindfulness. So creative mindfulness with a holistic approach. So we deliver skills development, creativity sessions, exercise, everything that leads to creative mindfulness. We deliver digital skills as well, although at the moment we haven't got funding for that, but we do have the SIM cards, the data SIMs from UK online centres. So we can distribute them. The one thing that I find difficult with that is many a time people that need those SIMs, they don't have the devices. So then we can't give them the SIMs because they don't have anything to use them with. So maybe that's something that they need to look into. Yeah, but other than that, in terms of our current delivery, all our sessions are full at the moment. So we've got Monday session, Tuesday session, and a Saturday session doing different things, but all of them are full. So we don't have capacity for taking in new people at the moment, but we will do in the future. So, we'll keep you updated and then you can share it for us.
Brilliant. Thank you, Fahana. Thank you very much. Pam, have you got any updates for us?
Just to say that I've took over from Adi at the gardening group that we do at the back of the health centre. It's the Goodwill Gardening Group, and that's on every Thursday, open to everybody between 1 and 2:30.
Brilliant.
And it's run alongside with New Ground Together.
Excellent. Lovely. I love my gardening. It's a really good way.
Well, I'm not right good at it, Tracy, but I'm learning.
I'm not good at it, but I give it a try. I give it a go.
Yeah.
It's just nice being outside and feeling the soil and the plants growing. It's just brilliant.
Yeah, it's lovely.
Yeah, I love it.
Brilliant.
Thank you, Pam. Thank you very much. Katie, you're next on my screen. Have you got any updates? I'm sure you have. You usually do. No?
Not really, no. So we're halfway through doing life skills at the moment in Colne, and it's going really well. I have got somebody who is going to join us after Easter. We always have a 2-week break at Easter. So I'm just going to meet with her and go through what we've already been through. So if you have somebody that could benefit from life skills, we have Jackie from New Ground coming to speak about energy. We do cooking. We look at budgeting. The tagline is living well on a low income. So that's what it's about. So if you have anybody that you think would benefit from it, do let me know. Because although we're halfway through, it's not too late. I can go through everything with people that we've already covered. And we're booking into June for the debt centre at the moment. I think we've only got 2 appointments left in June, but we are seeing everyone before then, because obviously that's too far away. Thank you.
Well, thanks, Katie. Thank you. Karen.
Hi. Yeah, no real updates from us. We're avidly awaiting details of the new funding, but I think we've got a food network meeting, haven't we, this week, Leanne? Cheers. Thank you.
Fab. Thank you, Karen. Dawn, have you got any updates from Family Hub?
I've not got anything massive. Just a couple of things to look out for. We've got some. There'll be some news coming shortly. So one of our centres will be a Best Start Family Hub. So we've got this Best Start funding coming from the government. But also there's a Lancashire directory underway. So at the moment it's not out to the public, but it will be something that people can register their organisations on, and there'll be different search parameters on it, so you can search by area or by type of thing. So something we've trialed before and it wasn't that great, but I feel like the new platform's a lot better, so that should be good.
These directories drive me insane.
There's one after another, but yeah, Lancashire Service Finder. I'm hoping that there's so many people tried a directory, but there's just too many. So hopefully this will be a good one.
It's fine with public and statutory services because they generally, if family hubs are there, they're there for a while.
Yes.
Councils are always there, in various guises, councils are always there. But any little community groups, it's just impossible to keep track of them other than with us through our funding.
Yeah.
Because they change so quickly, don't they? So yeah,
they do. But I think the focus on this is for people update their own their own organisations. But whether they do, it always looks brilliant when it's all shiny and new. But sort of 5 years down the line, when there's there's that play group on there that's not run for 3.5 years, but no one knows how to get rid of it. I'm hoping there'll be I'm sure there's lots of testing done on it. I'm sure it'll be great. But
I'm sure. Yeah. I don't want to sound negative, but I'm sure it will be.
Yeah, I think we've all seen those, but this one actually, I'm not just saying that because I work for LCC. It actually does look like a good one. So we'll see. They've moved across all the send information's already been moved across to it. So I know that's something that we always looked at Lancashire Local Offer for, but it has now all been moved across to the Lancashire Service Finder.
Great, brilliant. Thank you. Thanks, Dawn. Thank you very much. Lynn, have you got anything you want to update everybody on?
No, Kelly's kindly put my menopause session up now just in case. So thank you for that, Kelly. We have got things coming, working with certain various agencies. So once we've got all our information, we'll update you. Again, we've got lots of things going on in the background.
Fab.
Thank you.
Thanks, Lynn. Sarah, have you got anything?
Hi, no updates really for Pendle West or East INT. Only just that obviously Kim's retired now since the last meeting, and it's been passed into the hands of the lovely Jenny, who sadly had to leave because she had a visit to go to. So, but yeah, missing Kim already. But yeah, and Catherine sends apologies. She's on annual leave today, but she'll be back for the next meeting.
No worries. Thank you, Sarah. Thank you very much. Judith, have you got anything you want to share with everyone?
Just briefly, you probably are all aware that Making Tax Digital is about to roll out for those who earn over £50,000. So that would be priority cases being landlords, construction workers, and so on. Over the next couple of years, that threshold is going to come down from 50,000 a year to 30,000 next April, and finally 20,000 in April 28. Now, that probably brings most people who are self-employed into scope. What HMRC are keen to do is to help people get a little bit forward of the game so that it doesn't come as a huge surprise. We've been talking about digital access already today. This is very much about exemptions only for people who have, so health issues or some other plausible reason for not going online. It also makes a huge difference in the way that we account for our income in terms of tax. It'll be done quarterly, not annually at the end. It should make it easier, but the change is always difficult. We're funded by HMRC to provide support to people on tax issues, pension, child benefit, any in-work benefits that are still left. As you know, legacy benefits are off the cards now, so no longer dealing with that. But if there's anything that we can help with, we have an advisor available by phone or face-to-face. And I can put my details in the chat now. If you are interested in more details, I can send them along.
That'd be great. Thank you, Judy.
Sure.
Thank you very much. Thank you, everyone. I'll just give a quick update on some of our stuff. So I put together a CVS in Pendle report. If anybody's interested, I can send it out. I can also make it available on the People of Pendle webpage. That's about all the work done by CVS in Pendle over the last 14 years. It might be a surprise to some people, but CVS has brought in over £1 million into Pendle over the last 14 years for small groups. Nobody else is doing that. There's only us that bring in, the small, we're the voice of the small groups, and we influence people and try to, strong arm people into funding those small groups. So yeah, a lot of people have benefited from that money and the work that we do. It will be available, like I said, on the web page. But if you want to discuss partnership work in collaboration, or just have a chat about what work we do, if you don't know what work we do, please get in touch with me or our chief exec, Christine Blythe, and I would be happy. I do presentations all the time for various teams. I'm happy to do a presentation just to give you a bit of an insight onto what we do. Just a little bit about the Lancashire County Council Adult Social Care Transformation stuff that we've been doing. We've now got Annie Anderson that's employed as a social connector with a specialism dealing and supporting people with hoarding. She's not an expert in hoarding. She's supporting people into the experts. So referrals are increasing nicely. We've got 3 social connectors who specialise in adult social care, and 1 for each area. They work as part of the social prescribing team, and they support people in the same way social connectors. They're just as their specialism in adult social care. Our referrals have increased substantially over the last few weeks. We're also delivering a pilot telephone befriending scheme at the moment, funded by Lancashire County Council. We've got 6 volunteers at the moment who are allocated clients to telephone each week from our office in Yorkshire Street in Burnley. We're looking to expand this project as it is in great demand, as you can imagine. The idea is to befriend people over the telephone with a view to increasing their confidence and empowering them so they're able then to attend a community activity at some point in the future, which is entirely up to them. We go at their pace. So they're working closely with our development team to recruit more volunteers. Social prescribing and Eric Wright small groups funding will be opening soon. 8 Pendle groups applied and were successful last year for Eric Wright. 13 Pendle groups were successful with RCB funding, which was over £61,000. We've got confirmation of the funding, and it should be open May, June or July. It just depends when we get it in the actual bank. More Pendle groups applied for funding this year because we made a concerted effort to go out into Pendle and go, apply for this funding, get this funding in, you need this funding, have this £5,000. So we did all that. Health and wellbeing for children and families. We're still only able to provide a social prescribing service for children and young people in Brayfield and Nelson. We don't have any funding yet. Schools are closely linked with our team, and we get a lot of referrals from schools, but they have not been forthcoming with any funding so far, but I will be chasing this up this year. We're getting more people attending People of Pendle meetings, which is really good. On average, we're having 30 to 35 people at each meeting. I mean, there's been 20 this time, and it's increased since Christmas. It seems to be since we changed to the Teams meeting, more people are coming along. Pendle Network for Change I've talked about. There may be a new funding stream coming in from the National Lottery called You Decide. Christine is the voice of the small groups at high-level discussions such as this, and it's a bid in the National Lottery for funding for small groups across Lancashire. Pendle is a specific target for this funding, and the vision is to empower groups and volunteers to decide what's needed in their area and sit on funding panels to decide allocations of funding, which we've already started doing. So watch this space. Helping Hands Community Lottery. If your organisation ain't signed up, get them signed up, because you can raise funds really easily there. Integrated Care Community Health and Wellbeing Fund is stalled at the moment. And we are working with Edge Hill University to train volunteers and staff in effecting behavioural change, particularly in relation to chronic illness and inactivity. So Caroline has organised some dates, which we will be putting on the People of Pendle page. And just one more bit, and then I'm done. Our volunteer hub and our group support team have merged, and they are now called the development team, because they work together with volunteers, individual volunteers and volunteer involving groups and volunteer-led groups, and provide all that kind of funding from setup to close down and everything in between. So you'll see a lot more of Caroline. We've got our new Rebecca, who you will never see on these meetings because she's always out and about. You already know our Heather, and Julie, our project support, and Kim is our project support for the volunteering side of things. So yes, that's us. I've got a lot more that I could tell you, but I won't bore you with the details. It is now 3 o'clock and we're done. Thank you, everybody. If anybody wants to know any more information about our stuff, please do give me a shout. I'm going to shut up now because I'm running out of breath. and thank you all for being so engaged and so engaging. And thank you for those of you that came and said, I'll speak. If anybody wants 10 minutes at the next meeting, please do give me a shout. It'd be really good to hear something from you all at some point. So thank you very much. Have a lovely rest of your afternoon, and I'll see you next month, if not before.
Thanks, Tracy.
Take care.
Thanks,
Bye.
Tracy. Bye.
Thank you. Bye.
Thank you. Bye-bye.